Good evening, ladies and gentlemen. My name is Jason T. Mahoney, better known as the Motivator, owner and founder of Crafted to Motivate Limited Liability Company, where we make your dreams a reality, all by motivation. We're super excited to be here today to partner with the National Optometric Foundation to acknowledge the Glaucoma Month. Glaucoma Awareness Month is a great month because what we know about glaucoma is that it is a silent killer and it is impacting so many individuals if we don't address this problem. So Crafted the Motivate is so excited to partner with this awesome organization to educate the community and just inform and provide that education. But before we get started, I'm super excited to bring to the forefront the president of the National Optometric Foundation, the one and only Dr. Andre Whitehead. Dr. Whitehead, how are you doing this morning, this afternoon, this evening? It's
I'm
morning
doing
somewhere.
I'm doing very well, Jason. How are you?
I'm doing good. I'm doing good. So tell me and tell the listening audience about this awesome organization, the National Optometric Foundation, and how they can support it and why it is important.
Thank you, Jason. The National Optometric Foundation is the philanthropic arm of the National Optometric Association. The National Optometric Association is its main mission is to advance the visual health of minority populations. We all know that there are a lot of health disparities, and eye care is not excluded. The National Optometric Foundation assists the National Optometric Association to achieve its goal through community service, outreach, education, and scholarship. We are a nonprofit organization, so we work solely on donations. The donations go towards all of the initiatives that I mentioned before. And as such, it is very important because underrepresented minorities are sometimes pushed to the side, and we are trying to get them the care that they need.
Awesome, awesome. So the organization is really to support those minority students that are interested in a field of optometry and just really to support the community. So if everyone can do me a favor, our listening audience, if you can go to the National Optometric Foundation website. It is just popped there on the screen, and we want to give out some prizes throughout the night. So, what we would like for you all to do is to go to this website here, and in the comment section, we would ask you all to just put some information that you have found on the National Optometric Foundation website. And what will happen is your name will be entered into a drawing to win a prize, either a Cash App prize or a PayPal prize. But again, you have to go to the website, search the website, find some information, and then put in the comment box some things that you found. And the website is on the page. So, Dr. Whitehead, are you ready to get this panel started?
Let's go.
Let's go. Let's see who we have in the back. So in the back, we're going to call up to the front the next optometrist, and we're going to call to the front the one and only Dr. Paula H. Boone. Hello, Dr. Boone.
Hello, Mr. Mahoney. So nice to be with you tonight.
Absolutely. Look, always good to be with you. Love your smile.
Thank
Dr. Boone,
you.
can you tell the listening audience who you are, where you're from, and how long you have practiced optometry?
Oh, well, it's been a number of years. Over 40 years, actually. I was the first African American female licensed to practice in the state of Virginia. I practiced 10 years with two groups of ophthalmologists, and I practiced 30 years with the Naval Medical Command Center. And my office was in the Norfolk Naval Shipyard in Portsmouth, Virginia. So I'm now retired, helping my foundation and association as we try to recruit underrepresented, particularly African American students into the field of optometry because it is crucial. We need doctors who look like us, who understand who we are, our challenges, our disease processes, and we need more African American students to do that. One of our initiatives with the National Optometric Foundation is the NOA HBCU mentorship program, where we partner with the Poston Foundation, VSP Global, and other sponsors to provide funding for African American students who are matriculating at an HBCU. We offer them grant funding to help them with their pre-admission fees in terms of OAT, in terms of interviews. We have wonderful mentors who are members of the National Optometric Association, who serve as admission coach. Dr. Gerald Simon of University of Alabama in Birmingham is our admissions coach.
Okay.
We have other members who help students. So we are there to help them financially and to help them with their matriculation and admission process, even after they've gone into being enrolled into a school of optometry. So last year, the NOA gave away over $85,000.
Wow.
About $28,000 of that was to our HBCU students. I had 10 last year. This year, I'm excited to say I've got 18 in the program.
Okay.
So yes, we are happy, and I'm delighted to be a part of that process in my, as they say, golden retirement years.
So I don't think you were retired. I thought you were 16 when I first met you. But I do have one question, and I because next month is African American History Month, and so I want to make sure that the listening audience heard something that you said. That listeners on this call, we have the first African American female in the state of Virginia. Did I hear that correct?
To be licensed, yes.
To be licensed. Wow. So we have a living legend on with us tonight. So I'm super awesome. So I just have to give you a hand clap on that because I did not know that. Thank you so very much. So the next individuals that we have, that I call them double teams and double troubles. I've known these individuals for about 20 years, going on 21 or 22, no, 22. And so they are an awesome group of individuals. And I want to bring out the one and only Dr. Timothy O. Brown, better known as Mr. Positivity, always has positive words to say to everybody. So Dr. Brown, tell the world who you are, where you're from, and how long you have been in practice.
Hey, it's good to be with everybody. Thank you, Jason, so much for being with us tonight. I am Dr. Timothy Brown, graduated from Salus University, Pennsylvania College of Optometry in 2010, and I started out working with a practice in Augusta, Georgia, and then I did some corporate work from a multi-million-dollar company, and I mentor students in Alabama and Georgia and also in Indiana during that time. And I am now currently working with my wife at Insight Family Eye Care in Augusta, Georgia, where we specialize in vision therapy. We specialize in doing eye exams for children as well as adults there. And it has been a great foundation for helping people who may not know that they have certain eye diseases or they have certain eye disorders. It has been a great foundation for there. And I'm so glad that my wife took the step to start this practice 5 years ago. And I'm happy to join her now there in Augusta, Georgia. As a part of the National Optometric Foundation, I am the treasurer now, and I support our president and the rest of the members of the NOF in trying to help raise funds and so that we are able to support students who have the desire to go to school and become an optometrist as well, so that we can impact lives and we can help save some eyeballs there, one eyeball at a time. So the National Optometric Foundation partners and support the mission of the NOA, the National Optometric Association, and we've gone out and have done many vision screenings each year for different communities wherever we're having our convention for that year. So I've been having fun. I'm looking forward to our convention in California this year, and I'm looking forward to being a supportive member of the board along with our rest of our members of the NOF.
Gotcha. So Dr. Brown, I heard you say you're saving lives one eyeball at a time.
Yes, sir.
I think I'm going to, can we get a t-shirt with that? Because I like that slogan. So,
we can do that. We can do that.
Saving lives one eyeball at a time. Awesome. So you were talking about a young lady that has joined practice with you, that you all in a practice together. And I think you know her quite well. Can you tell us her name so we can bring her out?
Absolutely. This is my lovely bride, for 15 years, Dr.
Wow.
Rita Brown.
All right. All right.
Hello, everyone. Thank you so much to Jason and to the NOF for having me. I am Dr. Rita Brown, the better half of Mr. and Mrs. Dr. Brown. And yes, I practice with my husband in Augusta, Georgia at Insight Family Eye Care. Our slogan is we recognize that good vision goes beyond 2020. And that is exactly what we try to do. We go beyond 2020 in serving the community and serving our pediatric patients and doing vision therapy. So we just try to do outreach and show and educate people about the importance of having eye exams, especially at a young age, as early as 6 months is when we start seeing kids. And we are currently the only African-American practice in the city of Augusta, which is the second largest city in Georgia. And we are also the only private practice that is actually specializing in pediatrics and vision therapy. I always say we're the only one right now, but hopefully there will be more to come through the NOF and the NOA, helping other African-American doctors to become optometrists and open up their own practices as well. So thank y'all so much for allowing me to be with all of you wonderful people today.
Wow. So what I need the listening audience to do, I need you all to give us some virtual hand claps or just some virtual smiles, because you've heard so many historical figures today. You heard Dr. Brown say they are the only African-American practice there in that area. You heard Dr. Boone share that she is the first licensed optometrist in the Virginia area. And you heard Dr. Whitehead talk about being the president and what he's doing in his city. So again, you have what you call living legends right before you today as we celebrate what does it mean to protect our vision in 2022. And today we're going to talk about that, protecting our vision and saving lives one eyeball at a time. Love that slogan. So I'm going to get a t-shirt on that. We have to copyright that. So, and again, don't forget to go to the National Optometric Foundation website. And again, put in the comment box some things that you've learned, because again, we want to give out some cash prizes to those that are looking and watching at the same time. So Dr. Whitehead, but before we get started, can you also tell how long you have been practicing, what city you're in, and all those great things about you, Mr. President?
I was about to say, nobody want to know about me.
See, you thought I forgot about you.
I did, but I know better. The great motivator. I am originally from Jamaica, the country, not the place in New York. I currently reside in Atlanta, Georgia. I have been practicing for 18 years. For the first 14, I was in retail optometry. For the last 3 or so years, I have been working on a mobile eye clinic called Vision to Learn, where we perform complimentary eye exams and provide complimentary glasses to school-age children in
Awesome. So we getting a lot of hand claps there, and some people are in. Dr. Boone, I saw that your friend Patricia joined in and clapped hands. So let's say hello, Patricia. She's not playing Sudoku today. So we're going to jump right in and we're going to get started. We're going to have fun. And again, to our listening audience, if you have any questions about the topic today, please chime in and ask your questions, and we'll make sure and try to get those questions answered. If not, you can also go to one of our websites, either craftedtomotivate.com, and submit your questions there, or submit your questions to the Optometric Foundation website as well. So any questions that we don't get to tonight, please send your questions in, because again, we want to make sure that you have the information you needed to protect your vision in 2022 and beyond. So we're going to get started. So the first question that was submitted by our listening audience is, what is glaucoma? And Dr. Boone, I'm going to ask you to just tell us what is glaucoma?
Glaucoma is a devastating eye disease. It's actually a group of eye disease where that slowly causes damage to the optic nerve. Unfortunately, for African Americans, it is the leading cause of blindness. Glaucoma Usually is starts earlier in age for African Americans. The effects are more severe, and many are led to blindness because of the undertreatment in 3 to 15 years. So it is a disease that affects the optic nerve. It has to do with the pressure inside the eye. If you think of a tire, a car tire, and the pressure builds up. And as that pressure builds up because of increased fluid within the eye, pushing back on the optic nerve, it damages the optic nerve, which is the nerve that sends visual information from the retina to the vision center of the brain. And as that nerve is damaged, because of that increased pressure coming from an increase of fluid in the eye, the nerve starts to die. And unfortunately, once that nerve damage does occur, the vision is unretrievable. It's a
Wow.
permanent situation, and it's silent because there are no warning signs. There's no
Mm.
pain, there's no redness in the particular disease that's open angle glaucoma, which is what most African Americans suffer from. So you don't have anything signaling that there's damage going on in the back of the eye. The vision loss generally is peripheral, which we normally don't use. Many times we compensate and just turn our heads and we don't
Mhm.
realize that vision is gone. And once it's gone and it comes to a central area, which is called tunnel vision, and by that time, there's really little else that can be done. So it is a devastating disease that leads to blindness for 1 out of 7 African Americans
Wow.
in the United States. So it is devastating. It is a disease that we need to get the handle on, and we're going to try to do that tonight by giving
Wow.
information.
Wow. So what I heard you to say was 1 out of 7.
Yes.
That is a high number. Can someone put that in the comment box? 1 out of 7 are impacted by this disease. That is a lot. So that is why it's important that we educate our community and we're engaged. Dr. Whitehead, our next question: when we think about the impact that glaucoma has on a person's vision, as Dr. Boone shared with us, can you share with us pretty much holistically what is the impact or the effects that glaucoma has, just pretty much on the person as a whole?
As she said initially, you don't really realize that it's happening because it affects your peripheral vision at first. Um, but as it gets worse and worse and worse, you start to have tunnel vision, which starts to affect how well you drive. If you have a job in which you have to look up or look down or look off to the side, it can severely affect that.
Wow. Wow. So when we think about knowing the statistics, 1 out of 7, when we think about the holistic person can be impacted by the disease. So then we go to, how does this happen? Is it hereditary? What can we do to intervene? But how do we make that distinction? What do we do when we talk about, is glaucoma hereditary? Dr. Brown, Dr. Sharita Brown, can you tell us about the hereditary piece and what does that mean for us as a people?
Yes, I definitely am more than happy to answer that question. I can speak to that firsthand because I am what is called a glaucoma suspect, meaning I do have a family history of glaucoma in my mother who has been diagnosed with glaucoma. So there are certain tests that I have to do every year to make sure that as I get older, I'm not becoming more at risk for developing the
Mm.
condition, or if there are some signs that are developing, that the necessary steps will be taken for me so that I never lose my sight. As Dr. Whitehead and Dr. Boone were saying, like, you'll eventually get tunnel vision. So one of the reasons we advocate at our practice getting kids seen as early as possible, or just getting routine eye exams, because as the other doctors have mentioned, it's a silent killer. It's like high blood pressure. You're not going to know that it's happening until it's too late. So just coming in for your regular comprehensive eye exams, even if you see 20/20, it's good for you to come in to make sure you don't have these types of conditions like glaucoma, and getting with your family members, because oftentimes we will have people come to the office and they'll say, yeah, I know my grandma takes drops or my mom takes drops, but they don't really know what they're taking drops for. So just sitting down with your family members and asking them what they might be taking their medications for, so you will know if you are at risk for possibly developing glaucoma, since it does run in your families. Because the key with glaucoma is prevention. If we can catch it early enough, our goal is that the glaucoma outlives you. And by that, what it means is that you continue to have your vision and you never lose your vision or anything like that. So it is very important for you to get regular eye exams so you can find out if you are at an increased risk for developing it. And if you are sharing that information with other members of your family, like close members of your family, your sister, your brother, that kind of thing, so that they can also go in and have their eyes examined as well.
Gotcha. So Dr. Rita Brown, you talked about, you said the word suspect, and that kind of, shook me a little bit. So did I understand you to say that if it's a history in the family, then I could be suspect? So for example, I had an uncle that had glaucoma. So then would I be in that suspect as well?
Possibly. It's more so your immediate family, like your siblings, your mother, your father, that kind of thing. So when I say suspect, it means I have a couple of red flags. One of them is my family history. The other one of the big things with glaucoma is that your nerves tend to be large. But as African Americans or minority communities, we tend to have larger than normal nerves. So I do have a couple of red flags that put me more at risk, which is why they will do additional testing. But there are other red flags, like your pressure could be increased. Also, depending on the type of work environment that you're in, if you're in a profession, I have had professional or semi-professional boxers or semi-professional sports players like football players, anything where you're having a lot of impact to your head or trauma to your head. That also puts you more at risk too. Other things that put you more at risk is if you have high blood pressure, diabetes, those kinds of things are also risk factors that can also increase your risk of developing glaucoma, especially if you also have the family history of it or also having large nerves as well, the optic nerve in the back of your eye.
Wow. Thank you, Dr. Brown.
And
so I'm sorry, go ahead, Dr. Whitehead.
I saw a question pop up. Ask if LASIK surgery can correct glaucoma. The answer is no. Because glaucoma affects the retina and the optic nerve, which are in the back of the eye. Vision correction usually just deals with the cornea, which is on the front of the eye. So you can still have perfect 20/20 vision and still have.
Wow.
Yes. And I'll just chime in. I know I said that's why our model is vision, it goes beyond 20/20. People think that just because they have 20/20 vision that everything is okay. And you can have 20/20 vision, but you don't know what other disease might be lingering around that will eventually steal your vision from you, or of that nature, like glaucoma. So just because you have 20/20 now, there's stuff that you can do now to ensure that you will have 20/20 vision later. And the 20/20 vision that people often refer to only makes up, if I'm remembering correctly, only 15 to 20% of your whole visual field. Glaucoma is what affects the rest of it. So that 20/20 is only making up a small percentage of your total vision that you actually have.
Listen, I'm sorry, go ahead, Dr. Whitehead.
And that's how glaucoma is linked to diabetes and high blood pressure is one of the silent killers. Because just like you don't know you have glaucoma, a lot of times people say, I feel fine, I don't feel drained, I don't have a headache, but they might have high blood pressure or diabetes, and it's building up, but they don't know until it's too late when they're in the hospital, when it's really, really out of control.
Wow. So this dialogue is getting real. We have questions popping in all over the place. But this is good. So listen, audience, if you're sitting at home, please like and share this to let someone else know about the good information that is being shared, again, because we're all impacted by this, and we can do some things to make sure to keep ourselves safe. So staying in line of the family system, there were a couple questions that were asked about the family systems, high blood pressure, hypertension, diabetes, etc. So Dr. Brown, Dr. T. Brown, I would like to present this question to you. When we think about of course, medical history that individuals had mentioned, why is it so important to get those eye exams done? Just why? Why should we come?
Thank you, Jason. I think it's very important that we have this conversation tonight because too often people put it to the side when it comes to taking care of their eyes. And we want to tell you tonight, stop delaying getting your eye exam. Don't delay, do it today, is what I usually say. Um, Glaucoma is in that category of silent killers. It's one of the 3 silent killers that the NOA pushes out to the public to try to educate them about: glaucoma, hypertensive retinopathy, and diabetic retinopathy. So it's very important for you to get this eye exam so that your doctor, an optometrist, can detect any early signs of glaucoma, any early signs of any eye disorders that may be going on that you may not necessarily have symptoms of. You may not even notice that your vision is deteriorating. And because you're coming to this eye exam, the doctor is going to say, I see something that I think we should take a deeper look into. I want to send you out for a few more tests. I want to send you out for a visual field to see how your peripheral vision is. Or I want to take some photos to document how your optic nerve looks so that we can monitor it over time to see if there's any changes, see if it's getting larger, and see if the nerve fiber layer is being destroyed from some reason there that can indicate glaucoma is going on. I think it's also paramount that we get into our family business, get into the history of our family, ask questions at the family reunions and see who in your family has certain things going on so that you will be in the know of knowing who has what in your family. And then you can do what you need to do to make sure that you're getting checked early on versus later on. Early intervention is very important when it comes to our health, whether it's glaucoma, whether it's diabetes, whether it's hypertension. The sooner, the better. So if you have been delaying getting your eyes checked, I'm telling you tonight, do that no longer. I want you to call your local optometrist tomorrow and get scheduled for your eye exam. It's very important so that we can catch these things early for you and get them managed.
Love it. And Dr. Brown, I love what you said. You said, don't delay, do it today. You have a lot of t-shirt slogans. And so I love it. But it's so important, as you said, about making sure and getting involved, getting treatment and getting the services that you need. And so we had a lot of questions from our listening audience. One question said, if your family has a history of hypertension and or diabetes, are they more at risk for glaucoma? So Dr. Boone, I'm going to ask you if you can answer that for us, please.
The answer is yes, absolutely yes. Those conditions often have factors that lend themselves to development of glaucoma of the individual. So many times if a person has high blood pressure, they're also subject to have glaucoma. Diabetes, they're also subject to have glaucoma. There are also other risk factors. Dr. Rita Brown did mention some. Age is also a factor. It's generally, in the general population, they say glaucoma starting should be examined with the individual around the age of 40. But for African Americans, they recommend 35 years of age, a comprehensive exam to rule out the possible development of glaucoma. Now, glaucoma can also be found in children. So that's why it's so important to see practices like Dr. Brown, who also examine children, because children can develop glaucoma as well. Other risk factors also include being nearsighted. If the child or the individual is highly nearsighted, that is also a risk factor to development of glaucoma, as well as sleep apnea, which is a condition, a syndrome quite frequently now being treated by individuals in the African American community. And certain medications can also put you at risk at developing glaucoma, as well as smoking. So to answer that, yes,
Wow.
yes, yes.
Wow. So thank you. Wow. Dr. Whitehead, I'm going to give you that next question. What about cataract surgery? Can that reduce the pressure when removed?
I would say no. That
Possibly.
it,
Yes,
it,
I
I
would
don't
say,
I don't know.
depending on the surgical procedure, many times if the individual does have glaucoma, when they do cataract surgery, from my affiliation with ophthalmologists, is that they will also do a procedure to increase the flow of the fluid within the eye when they do the cataract surgery. So it's
Right.
really, it can reduce the pressure because the surgeon is in tune to what needs to be done with that individual who has cataract surgery. So he can do a 2-for-1 procedure to reduce that pressure for the individual
Yeah.
because
So the
uh,
cataract
there's
surgery
critical,
itself that would reduce the pressure. They would do an
yeah,
additional step to help to
right.
reduce the pressure.
Now, for the individual who asked about LASIK surgery, which is a surgery that's usually done on the cornea, there is a laser surgery to open up the trabecular meshwork within the eye to help the flow of fluid through the eye. So, laser surgery is one of the treatments of glaucoma, not LASIK surgery.
Mm,
Mhm.
gotcha. Gotcha. So I'm going to ask Dr. Brown and Dr. T. Brown and Dr. Whitehead this question. As the men on the call, as we know, men, we do not go to the doctor. We have to, be pulled, snatched, and all those things of that nature. So we do have some men that are listening right now. What would you say to the men that are listening about glaucoma, and what do they need to do from an eye health perspective? Because we may go to the doctor if we stub our toe or something happens or we get drugged, but we may not focus on our eyes, right? So what would you encourage us about our eyes? So
Mr.
either one of
President.
y'all can go first.
I would say just go. Don't delay, as Dr. Brown said. Just when and I am guilty of not going. So go get your eyes checked, go get the prostate checked, go get your stomach checked, your chest checked, go get everything checked. Because again, as one of the silent killers, you don't know what's happening. And
Mhm.
men, and I don't want to offend anyone, but men are typically providers. And your eyes are very important. If glaucoma starts to affect you, if you start to have very deleterious effects from glaucoma, then that might prevent you from being the provider that you want to be.
Wow, I love that. Love that.
Yes, Jason, as some encouragement to men who are married, listen to your wife. Get your eyes examined. I am so thrilled when women drag their husband into the office and said, he's going to get his eyes examined today, and I'm here to make sure he stay inside the office until he get it done. I applaud them for that. And ladies, I want to encourage you to keep pushing your man into those doctor's office there. We need to get checked. And all it takes sometimes is for you to be there to support him and let him know, hey, everything's going to be okay.
Mhm.
And I always tell the guys, if you don't go, you don't know. So you need to get in the door so the doctor can find out, is there anything going on? There may be nothing going on. It may
Right.
be that you only need reading glasses because you're getting over the age of 40 and things are not quite as clear for you. So do not be afraid. Go get your eyes examined. I promise you, we will not hurt you. We're only going to help you in the process.
So I am going to take every quote that Dr. Brown has said. He said, if you don't go, you don't know.
Don't. Okay.
They just come out the blue. So
The
speaking
quote I
of
like is listen to your wife. I'm on
Yeah,
recorded.
I do too.
so I wish you all could have seen Dr. S. Brown in the background. She was like twisting her head. She was like, absolutely, absolutely, doc.
Mhm.
So speaking of Dr. S. Brown, and you talked a little bit about, just making sure going to the doctor, being vigilant about that, young people, family history. And so I'm not sure if there's a relation between this, but I do know, if I'm not mistaken, that you do something with young people that is kind of of unique to kind of promote eye health at an early age. Can you talk about what that is and kind of how that helps, the family system, et cetera, throughout history and throughout hereditary perspective?
Yes, so pretty much we specialize with pediatrics or young children, but we also do something called vision therapy, which I usually say is like physical therapy for the eyes. So oftentimes some children will have certain visual conditions. They might see 20/20, but they struggle with school or they struggle with reading or learning because their eyes can't track or follow like they're supposed to, or they might actually have an eye that turns out or turns in, and that is an impact in their reading, their learning, and development. So this isn't exactly associated with glaucoma, but it does impact the family unit if the parents are struggling with them with getting homework done, or they're getting labeled in school as being misbehaving or having ADD or ADHD and things like that. Oftentimes, it might just be a visual issue that is causing them not to want to do their work or having trouble doing their work. And so we show the parents what is going on and how this is impacting them in their schoolwork, how this might be impacting them in their behavior. And through vision therapy, we can make some changes and teach them necessary skills that they have or the skills that they need in order to thrive well in school. So I often use the example in these instances because the parents will come in and I'll tell them that their child sees fine or that they have 20/20 vision, but I'll say they'll have something else going on that's impacting their reading. And they're like, how is that so if they have 20/20 vision? So I usually use the example of like, both of us have arms and legs, or I have arms and legs. I can walk, I can use my arms, but I can't play basketball. It's not that there's anything wrong with my arms or legs where I can't play basketball. I just don't have the skills to play the basketball. So my arms and legs are healthy, but I lack the skills. And that's how I explain it to them. Their eyes might be healthy, but they lack certain skills in order for them to do well and perform well in school. So.
Wow. Okay. Wow. That's kind of unique. So can anyone just show up and get that eye therapy? What does that look like?
So usually we always start with a regular eye exam because sometimes they might need a prescription. So if they need a prescription, we want to make sure that they are in the best pair of glasses so that doesn't skew the results of our testing. And then once we determine it's not just a prescription issue, then we would do further extensive testing that takes a couple of hours to look at how it's actually impacting them with their learning, their reading, and things of that nature too.
Okay. Perfect. Thank you so much.
Jason, may
Yes,
I
sir.
add, Jason, the vision therapy that Dr. Brown is doing at the office has gotten results such as parents telling us, hey, my child can ride their bike now for the first time by themselves.
Wow.
My child now, they're passing their grade and they're doing well because now they can focus and pay attention in class because they can see better. So there's a lot of rewards with the vision therapy side there. And I just want to add that in there. So for those who may be listening, they'll know a little bit more about the rewards of vision therapy.
Wow.
For children.
Yeah, vision is very powerful. It impacts your behavior in so many ways that you don't know. Oftentimes, I'm sure Dr. Whitehead and Dr. Boone can come attest to this. Oftentimes, I'll have patients come in and I won't say I can tell their life story, but just based off of how their vision and how they're interacting with me, I'm like, I bet you do this. I bet you do that. I bet. And they're like, how do you know? I'm like, your eyes just told me everything. So it really does impact you in everyday life in so many different ways.
Wow. So Dr. S. Brown, the next time I see you, I'm gonna make sure my eyes are closed because I don't want you to have to tell my story. so we do have a question. It says, how does smoking and or using marijuana affect glaucoma? Who would like to tackle that one? Because there's so much political stuff that's going around with this question here. So who would like to be brave to tackle this?
I knew it was coming up, so I'm ready.
Okay, be ye also ready. Go ahead, Dr. Boone.
Because I live in a state in Virginia, and they're in they using marijuana now for medicinal purposes, and they're trying to get recreational use, and everything is cannabis, and they're looking at marijuana to cure everything. But according to the National Eye Institute, the compound THC, which is in marijuana, does lower your eye pressure, but only for 3 to 4 hours. So the elevated eye pressure, the IOP, which is what we call it, in glaucoma patients, needs to be lowered 24 hours a day. So the beneficial uh, effects of lowering pressure coming from smoking or ingesting THC from marijuana, you would have to ingest about 18 to 20 milligrams of THC 6 to 8 times a day, which is about every 3 to 4 hours a day, every day. That will leave the individual mentally impaired with abnormally high heart rate, decreased pressure, blood pressure, which will reduce the blood flow, which will increase damage to the optic nerve and would ultimately not be cost effective. So, glaucoma is not in any form recommended for the treatment of glaucoma.
I mean, marijuana, I guess.
I mean, marijuana. What did I say? THC, marijuana is not recommended in any form. Drops, ingesting, smoking, it does not benefit you because 3 to 4 hours is not sufficient to save your sight from glaucoma.
Wow. Listen, I need for everybody, all the listener audience, to please give Dr. Boone a hand because she said, you're not going to get me tricked up with this question. She said, I'm not going to deal with the politics on this. Awesome. But thank you so much for providing information. So, Dr. Whitehead, question for you.
Mm-hmm.
How important is sleeping for eye health and eye care?
How important is sleeping?
Yes, getting your rest. Yeah, getting your rest. Closing those eyes.
Well, getting sleep is just good overall. Especially people who use the computer, your eyes tend to be open, your eyes tend to dry out more when you are on the computer all day, because a lot of times people forget to blink. Rest is good to help to rejuvenate the body and help to rejuvenate all the nutrients in the eyes.
Awesome. Thank you so very much. So when we think about eye health, getting treatment, et cetera, I often liken our health to a car. You know, when our check engine light come on, we go get it checked out. Some of us, when our low oil light cut on, you know, we go get it checked. When we have a flat tire, we go get it checked. I'm going to ask a reverse question. Why do we think people do not engage in eye health? What is that fear there for? Why do y'all think that, Dr. S. Brown? Why do you think people are fearful to come in to get that services that they need?
I don't know if they're fearful. I think they just think like once you have 20/20 vision, you are fine. And we just try to dispel that myth like 20/20 is not enough. 20/20 is, like I mentioned earlier, is only a small portion of your vision. And also they think that if you don't need glasses, then you don't need to come in and get checked. And I always try to advocate to my patients that I know you came in for glasses, but I'm glad you came in so I could check the health of your eyes. Because if your eyes aren't healthy, there's nothing I can do with these glasses. I'm not Jesus or whatever. I might look heavenly, but I'm not performing miracles back here. And there's nothing we can do with your eyes to make it better if they are not healthy. So I don't know. I don't think they're necessarily afraid. Some of them very well might be afraid, but I think most of them just feel like, oh, I see fine. And then they come in. And what they don't realize is most conditions that actually affect your vision are painless. They are painless. So you are just like with glaucoma, you're not going to know what's happening until it is too late. Even how high blood pressure and diabetes affects your eyes and some other ocular conditions that affect the eyes, they are painless. You're not going to have pain and you won't know that anything is going on. So oftentimes, we associate pain. If you're hurting, then you go to the doctor. If you feel bad, you feel sick, you go to the doctor. So it's just how society automatically equates going to the doctor. If I feel bad, I go and get checked out or whatever. And so they feel like if I see fine, I don't need to get seen. But there's so many things that could be occurring and you don't even realize it's happening. So it's always best to get checked out. And like what my husband said, if you don't go, you won't know. So Best to find out find out the information.
I'm going.
If
Go
I
ahead,
may
Dr. Whitehead.
comes to fear, a lot of times it's people are afraid of the unknown and they don't come in because they don't want to hear bad news.
Wow. So speaking of that,
that's a lot
yes,
of
sir.
times why people are afraid of doctors, because they're like, I don't want to go. It's like no news is good news. If I
Good
do it
news.
myself, then yes.
Wow. So speaking of that, when you talk about not necessarily being afraid, but may get some bad news, and as Dr. S. Brown says, she may look heavenly, but she can't, doing the miracles back there. So we talked about things that we can do early on, come and get your eyes checked, et cetera, et cetera. But I do know that there's some individuals that are listening right now who may already be impacted by glaucoma. Either they may have it or a family member may have it. So Dr. T. Brown, can you tell us, if a person has been impacted and they currently have glaucoma, what's the next steps for them? What can be helped for them? What can we do for them?
Jason, thank you for the question. One of the main things that we want you to do is be positive. I am also known as Mr. Positivity. So just know that you need to follow closely with the guidelines that your optometrist put in place for you. If they prescribe drops to help lower your pressure, and they said, hey, you need to make sure you take these drops each night before you go to bed, follow those guidelines. If they said, hey, I have a drop for you, I need you to take one in the morning in your eye and one at night for your eye, follow those directions. It's one thing for a doctor to be there to help you, and then another thing for you not to follow the directions of the doctor. What helps determine the best management and treatment for glaucoma or any other eye disease or medical disease is when the doctor and the patient are together. The patient is doing as the doctor instructed, so that when the patient has their follow-up appointment in 3 months or 4 months, they can see the results of following the guidelines that the doctor has in place for their medications there. So I want to encourage people to make sure you follow those guidelines there. There's sometimes with glaucoma, the pressure is high. They're going to prescribe prostaglandins, certain drops to help the pressure so it doesn't cause damage to the back of the eye. And it's very important to make sure that you are following the guidelines for those drops. Also, Jason, outside of drops and medications, exercise, take care of yourself, take time for self-care. Self-care is very important. Make sure that you're eating green leafy vegetables, making sure that you're eating your spinach, making sure that you're eating your Brussels sprouts, making sure that you're eating, taking your vitamin A, taking your lutein, zeaxanthin, your fish oils. All of those things are good for the body. All of those things are good to help support eye health. And we want to make sure that you know overall all of those things. That's a combination of things that's helping to keep your eyes in the proper place that they need to be so that you're not losing sight.
Awesome. Thank you. We have another question here. Dr. Whitehead, you're up on this question. It says, as far as treatment, which is better, drops or laser surgery?
Which is better, one or two? Laser surgery would be better, so to speak, because it gives you that drastic drop in pressure. However, the laser surgery is usually done after drops are tried. You usually try the drops first to get the pressure to lower, and if the drops are not bringing the pressure down as much as we'd like, then they move on to surgery.
Gotcha. Wow. Thank you.
And I would add, the drops are less invasive. So just like what my husband was mentioning, if you're not taking the drops like you're supposed to, then they may use the laser as an option because they see that you're not compliant, which means that it's going to be more invasive to you where you could have just been taking the drops. So also keep that in mind as well.
Gotcha.
One other thing, Jason, and speaking of compliance, the reason why I say follow the guidelines of the doctor is because when you come for your follow-up appointment and they have prescribed that you take drops over a certain course of time and you come back and your pressures are still high, the doctor is wondering, are the drops working? Or maybe the patient is missing some of their drops. So it's important for you to be honest with the doctor. If you forgot to take the drops a few days, a few weeks, you never started, you haven't even gotten the prescription filled, please be honest with us. You know, we are here to help provide care for you, to help take care of your eyes, and to keep you seeing as well as you can for as long as possible there. So make sure that you're including that at the beginning as your history. When maybe a optometric technician may be asking you about your history, asking you how the drop's going, just be honest. If you forgot, it's okay. It helps us to make sure that we're not adding another drop, thinking that the first drop wasn't enough, and really you never started the drop. So,
and a lot of times we already know. We just asking you to see if you can tell us the truth.
I'd like to add to that compliance is crucial. It's crucial to have a working relationship with your doctor, that you trust your doctor, that you are in fact going to do what they say, so they can find out if the treatment modality that they have prescribed for you is working, because it depends on the type of glaucoma you have. Other factors will determine what treatment modality the doctor is going to prescribe for you. And if you are not compliant, as Dr. Brown has said, we don't know if that's working. And if it's not working, then we could add on an additional cost, because the drops are expensive. Also, that might be a factor. And if it is such that you can't afford the drops, let your doctor know. Tell them, I can't afford the drops. And many times there are insurance companies or drug companies that will make some compensation, or they could switch to a drop that may be the same category, but not as expensive. So cost is a factor. All of that you need to share with your doctor. It is a working relationship between your patient and the doctor, your healthcare provider. So that's why it's so important that we need more students, more African American, more minority doctors and healthcare providers who look like us, who you trust and can say, well, doctor, you know what I'm going to, I can't afford this. Can you help me? So that is crucial, that we need to have that working relationship with your healthcare provider.
Thank you.
Yes, and to add on to what Dr. Boone says, that's why the NOA and the NOF is just such a wonderful organization to support other African American doctors, because we know that, when our patients see us, they open up more to us, they can relate to us a little bit more, and we get the honest answer. Sometimes I look at them and like, you didn't take those drops, did you? And they'll laugh and whatever. But you got to make them feel comfortable so that they can open up and let you know what's going on, and so they can feel comfortable enough, so I can give them the best eye care place. Because I'm like, you're not losing vision on my watch. So what you doing? Are you taking those drops? Because we're not losing any vision on my watch.
I know that's right. We're not losing any vision on my watch. You two are just, I'm just going to come to work with you all one day with a notepad and just write all these quotes down. But what I heard from this segment, this last question, was it's important to have a relationship with your healthcare provider, and then go to a provider that you feel comfortable with. Use the prescriptions as prescribed, and do not use your cousin eye drops just because they're using the eye drops. Get your own prescription. Is that Dr. White is like, no,
get your own prescription, get your own glasses. Don't wear your cousin glasses, all of that.
Exactly. Or pick up somebody's glasses and be like, can I borrow your glasses or what have you? Good stuff. So we're about to wrap up. We're already at the hour mark, and so if we have anyone in our listening audience that want to just pop in any comments, if you all can actually just pop some comments about what you've learned in this session today, any feedback that you want to give to these awesome doctors here, you can give them some hand claps, but they are phenomenal. So if you all can just give some comments for them, and please go and visit the website for the National Optometric Foundation. And again, support this awesome organization. So, but before we go, I'm going to ask each of these great doctors to give us one tip that we can do to care for our eyes. One tip. Okay. So I'm going to start with Dr. Whitehead, and then I'm going to loop back around. You're going to close us out, Mr. President. So Dr. Whitehead.
I would say smoking cessation. I know this is a touchy topic for a lot of people, but smoking usually causes the blood vessels to constrict, And especially in glaucoma, a lot of people talk about glaucoma and pressure. A lot of the medications are used to reduce pressure, and pressure is one of the risk factors for glaucoma. But another theory is that the optic nerve starts to die because it's not getting enough oxygen, not enough of a blood supply. So smoking cessation can help, because when you smoke, the blood vessel constricts. You're not getting a lot of blood supply to the optic nerves, and that goes along with diabetes and high blood pressure as well. That's why when you have those two diseases, you have a higher risk of developing glaucoma because it affects the blood supply that's going to the eye. So smoking cessation and keeping your blood pressure and diabetes in check.
Awesome, awesome. Thank you, thank you. Dr. S. Brown.
My tip would be to wear your glasses. Oftentimes people think wearing glasses is going to make their eyes work. Wearing glasses is how they got the cataracts or how they got glaucoma. Wear your glasses. The glasses are not making your vision worse. It's usually the activities that you are doing that make your vision worse. And usually once you have the glasses, you realize you are seeing so clearly that you didn't realize how poorly you were seeing before. But the glasses are not making your eyes worse. They don't cause you to have cataracts or glaucoma. So I know that's a common myth or things that some patients will ask me. Wear the glasses. They will help you to see better. So that's my tip, my takeaway.
Awesome, awesome. Thank you, thank you. Dr. Paula Boone, what is your one tip?
My one tip is to know your numbers. I always tell my patients, know your numbers. Either in any of the three silent killers, whether it's glaucoma, diabetes, or hypertension, know your numbers. If the doctor says, oh, your pressure's a little elevated, we're going to watch it. Ask him for the number. What is the number? Is it 12, 14, 24, 36? For high blood pressure, know your blood pressure readings. The doctor said, well, your pressure is a little elevated. Ask him for the numbers. If it's 200 over 160 or 120 over 80, know your numbers. As far as diabetes is concerned, how is your blood sugar running? You know, is it 100, 200, 300, 400? What is your A1C? I say be an active participant in your own healthcare and know your numbers.
Awesome. Thank you. And Dr. Timothy O. Brown, Mr. Positivity.
Yes, Jason, my tip for tonight is going to be wear sunglasses. Many of you know if I'm taking a selfie on social media, I usually have my sunglasses on, and it's important to protect your eyes from the sun. The UV rays can cause more damage to your eyes than you know. UV rays can actually cause you to have early cataracts forming. It can cause the progression of cataracts. It can also cause certain cancers of your conjunctiva. It can also cause your cornea serious burns and injuries as well there too. So I want to encourage you to wear your sunglasses year round, even if you're not in the sun. The UV rays can damage your eyes, and we want to make sure that you protect your eyes, even if you have to wear a hat on your head to hide some of the sun rays from coming in. Make sure you do that, and do not look up at the sun. Thank you.
Wow. So you just taught me something that I need to follow with. So I need to go and find some cool Kappa sunglasses. So,
and make sure you get them polarized.
Gotcha. Doctor. Oh, go ahead, Dr. Boone. Yes, ma'am.
About it, Dr. Brown did remind me, comprehensive eye exams. When you go to get your eye exam, just a refraction, and they give you glasses, that is not a comprehensive eye exam. Make sure that they check your pressure, that they give you a visual field, that they dilate you, that if they have instrumentation to do scanning of the optic nerve, make sure that all of these are in place. So blood pressure, intraocular pressure, dilation, visual field, even the corneal thickness, pachymetry. You want to do that as well because that is a factor in diagnosing glaucoma. So a refraction and glasses is not a comprehensive eye exam.
Wow. Wow. Thank you so much. This is some good information you all are seeing in the comments that are popping up there. So Dr. Whitehead, can you please tell us what is the NOF, the NOA, you know, where are we at? How do we reach you? How do we support this organization so we can have more doctors in the field? What do we need to do? Tell us how to make a donation. How do we support you all in this great work that you all are doing?
So first, I want you all to remember the 3 silent killers. It's an NOA initiative. Remember glaucoma, diabetes, and high blood pressure. Go get them all checked out, and they're all connected. Of course, we want you to donate, donate, donate. We are a nonprofit organization. National Optometric Foundation, there is the website right there. And again, we are focused on advancing the visual health of minority populations. We do that through outreach programs such as this webinar, such as this live. We also do community service events. But the other leg is that we do want to recruit more underrepresented minorities, Black students into colleges of optometry, such that when patients come to the eye doc and they see someone that looks like them, they're more likely to open up and have a relationship with that person, and they'll be better off, and that will enhance the quality of their eye care.
Awesome. Awesome. Thank you so much. Ladies and gentlemen, you have heard it. These awesome doctors of optometry came to give us lots of gems, lots of nuggets. We appreciate them, and be on the lookout because they will be doing more webinars and more seminars focused on the 3 silent killers, as well as just to let you all know about the importance of eye health. Again, please visit their website at www.nationaloptometricassociation.com/foundation. Go and make a donation of any price. Again, we want to make sure that we're supporting our community, our minority community, our Black and brown students as they matriculate through school so they can come back and help our community. Again, this is Jason T. Mahoney, better known as The Motivator. Looking forward to hearing from you in the near future and listening with you as we hear more information from the National Optometric Association. Have a good night. Stay happy, stay healthy, but most of all, stay safe.